The Behavioral Health Services Department supports wellness centers through grant funds. That was in collaboration with County Office of Education. And through those grant funds, we are supporting 6 wellness centers in the County of Santa Clara.
In 2020, I introduced a referral called the Children's Roadmap to Recovery, which included, among other supports, a plan to expand school-based wellness centers at as many schools as we could fund.
The beautiful thing about this collaboration is it brings a whole system together. And instead of having 3 unique systems like the school district, the County Office of Education, County Behavioral and Mental Health, we integrate one system and take the best of each system to really build out for our community a supportive structure for students.
I love my wellness center because, the minute you go in there is so warm and comforting. People are already there to help you.
Good morning.
Morning.
There are multiple activities you can do. So, you can draw, maybe play a board game, you can do some coloring. There's snacks in the corner as well as hot chocolate and tea you can make. There's, water sounds in the background. So the minute, you return back to your class, you feel a bit rejuvenated and a bit ready to get back to whatever you're doing because you let your mind rest for a second, so that way when you're back, you can be all fully focused.
I hear stories, but I think more importantly, I see it in my interactions with students outside of the Wellness Center, students that I know access the space. When I see them in class or I see them out at lunch and break, I see a student who is better connected to adults on campus. I see a student who advocates what they need more quickly and in a more timely way. And whenever you see a student have the language to ask for support or advocate for a peer, you know that you've created an environment where a student is going to leave your system with the skills they need to be the productive adult in our world.
The Wellness Center space at schools would be also destigmatizing mental health, really opening up and normalizing mental health needs among students. And looking at opportunities of where they can access services.
In reality, we need to destigmatize that buzzword of mental health. It's more than just, a political term that can be thrown around. It's actually something that's a pressing issue and something that needs to be addressed. And we need to make sure that we are allowing children to go in, find out what they need for themselves, and giving them the resources to do so.
We want to be sure that families, children, and young people have access to what they need. We need to be investing in prevention and early intervention and really making a difference early on in lives of people before they get to a point where they need more treatment services or they're more involved in systems.
Trying to build out the schools as a connection point is really important, but balancing it too with, of course, maintaining all those academic priorities. It's a lot that schools have to handle, but I think they just provide great models of how to do all of that and help families and students.
Well, one of the things that we've been committed to for years, even before it became vogue, is educating the whole child. And just like we know our employees bring their whole selves to work every day, our students bring their whole selves to school every day. And we really are leaning into, yes, we want them to excel in academics, but it's more than just excelling in academics. We welcome the whole child and we will support the whole child, take them where they are and move them forward productively.